Well, part of the stimulus package also includes temporary expansions of insurance assistance and public coverage programs, steps that the Democrats hope will open the door for major health changes. This comes as U.S. cases stay below 100,000 for a third straight day for the first time since early November. Here to discuss on the phone is nurse manager of the biocontainment unit at Johns Hopkins Medicine, Nisa Ernst, live from Baltimore. Nisa, thanks so much for being here. It's great to have you on the show this morning. What are your thoughts when you see the third day in a row of cases under 100,000 in the United States?
I say, oh my gosh, hope is on the horizon.
Yeah.
We're not quite there yet. We still have to mask and social distance and all those things that I talk about every week. But you can see the hope that the vaccines, even in the sort of not so great rollout that we may have had nationwide, but there's hope, Tim, and that's really good. And there's hope in a lot of ways. You talk about small businesses and people getting back to work, and that's what some of those numbers mean as well.
So do you think, Nisa, the decline that we're seeing right now is a direct result of the vaccine already, or is it too soon to see the results of the vaccine? Because even though we have given out quite a few doses, administered quite a few doses here in the U.S., millions, when it comes to the proportion of the population who has received 2 doses for the full efficacy of the mRNA vaccines, we're in the low single digits right now.
Sure. No, I do think that it is very early to say that the vaccine is causing those numbers to be reduced. I do think that some of the reduction comes from people following the guidelines. Also, some other things that we didn't have this time last year, our monoclonal antibodies, which are keeping people out of the hospital. Some of these, here in Baltimore, we have our field hospital, which is opening up beds at our own hospital. So there a lot of lessons learned, Tim, are finally coming to that point where we can keep those numbers decreasing.
Nisa, the CDC has updated quarantine recommendations for people who have been fully vaccinated. Fully vaccinated people who meet these criteria are no longer required to quarantine following exposure to someone who has had COVID-19. I mean, if you think about this, it's really fantastic news for people like you and your employees and, of course, healthcare providers around the country who are in contact with COVID-positive people each and every day. But I'm wondering what this means, because we have heard confusion around whether or not people who have been vaccinated can still carry and transmit the virus.
Yeah, it's interesting. I've read the studies, and it still is clear that there has been no large study that has come out that says the vaccine can or can't prevent transmission. So that's where we have to be, we still have to stay in our habits. I'm looking at the CDC guidelines. And, you talk about quarantine recommendations for vaccinated persons who meet criteria. That means having had both vaccines and 2 weeks after your last vaccine and asymptomatic. Still very encouraging. You're right. I mean, you're going to get people back to work, whether they are healthcare workers or whether they are other types of workers. But I would approach everything with a great deal of caution.
I want to get your thoughts on double masking, because we're also learning from the CDC now this week that it's recommended that Americans wear a cloth mask over a medical mask, but it's not as simple as that. There's do not do 2 disposable masks is what they're saying. Should we be double masking?
So at Johns Hopkins, Tim, we are not encouraging double masking. And again, the science changes every day, and I agree with you, it is very confusing. One of the things that we have to really remember is that the mask has to be effective. And I will tell you that I see, especially interesting enough in a lot of an older population, you have these masks that really look worn out. And so if they're not covering your nose and your mouth effectively, or the cloth has worn out, or any of the elastic was worn out, you're not protecting yourself. And that's where people say, well, maybe we should put another mask underneath that. I don't know that I can make that decision today, but I will tell you one of the things I see when people do double mask is they get less vigilant about their social distancing. And they also have a tendency to say, I have 2 masks on, I can't breathe. So they take both of them off. which removes that protective barrier.
Interesting. That's very interesting anecdotal evidence about behavioral changes about double masking. Important stuff to keep in mind. Nurse manager of the biocontainment unit at Johns Hopkins Medicine, Nisa Ernst. Nisa, thank you as always for your time. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.